chronic pain in EDS goes beyond joints, and it can impact the full body. It's a full body experience. Connective tissue disorders in general involve everything, and EDS is part of that, Ehlers-Danlos syndrome. And with EDS, a lot of times people have MCAS, mast cell activation syndrome, which also affects pain. There are different things that are involved. I've done videos on how it can involve the heart and kidneys and digestive tract, etc. It's a full body system. So what we want to do is we want to address things in such fashion that we lower the level of inflammation, because we already know that inflammation only accentuates all of our problems. When it comes to managing hypermobility, movement is the first step in the right direction. And I'm not saying it because I handle joint hypermobility. I'm saying it because this is a proven fact. So we want to move. Not every movement is a safe movement. I understand. There is a term kinesiophobia, which is fear of movement, because every time you move, you're hurt. But if the movement is safe movement, which I'll elaborate on in a little bit, then you can intercept this cycle in a fashion that you can take better control. So micro stability or micro instability leads to constant muscle overuse. When you use your muscles as a way to stabilize yourself and to protect yourself, then that's not what their job is. So we impact that portion of our existence. Your nervous system can be hypersensitive from all the different things that it's handling, and that can amplify pain. And fatigue and poor sleep can also worsen pain cycles. So all of these lead to further inflammation, and they can lead to accentuated issues that could be from digestive tract to whatever. This video is not about pointing out the different things that you can have issues with. This is to bring to your awareness that these other issues, systemic presentation, are not separate issues. So you should not look at it as, oh my gosh, my body's given up on me, which is some things I have heard in my practice. I want you to know that these are different presentations of the same problem, and when we manage it, they all will go down. So the management starts by pacing your activity. You have activity lists that each one consumes so many units of energy, and you wake up in the morning and you realize your level of energy is less than all of these added up. So then you look at your list and you see how much does your energy today fulfill, how much on that list is going to be tackled with your current level of energy. Allow yourself to rest. Allow yourself to sleep. You're not being lazy, you're being smart. Pay attention to these things, because people who know you understand you're not being lazy. People who don't know you, you shouldn't care. Educate people, point them in the right directions to learn more, and be okay with what they say. I know it's easier said than done, but please focus on what matters. So then you are breathing biologically. This is how your body resets everything. When you breathe biologically, you address your vagus nerve, you address muscle tension, you address oxygenating yourself, you're addressing anxiety, you're addressing so many different things. So become the expert in bendy breathing. Once again, we're going to put bendy breathing video at the end of this video. Subscribe to the channel so you learn more as I produce more and more videos. You want to do developmental exercises, which is what my channel is all about. That's what I do in my practice. That's how I educate my patients. So it's not all about them coming to me, but them understanding how to be, so they can take control of how their movements are, so the movements become more stable and less injurious. When you do these things, your level of inflammation goes down, your nervous system has a lot less static to deal with. You can regulate your nervous system, and ultimately over a course of time you can manage your hypermobility better. So even though hypermobility, connective tissue disorder, involves more than your joints, it's highly manageable. My practice is full of people who are living testimony to what I'm saying, and you're no different. I hope this helped you. If you have any questions or comments, please use whatever below in the comment section, and I get to see it. If you need to contact me, use one of the methods of contact in the description box. Contact the office. I'll be more than happy to hop on a call and see what's going on. Until next time, take care.